In this short video demonstrating Healthy Time's capabilities, we'll be reviewing Vista integration, selecting a site, facility, and clinic, entering and viewing data for resources and patients, group and telehealth appointments, provider and clinic availability, automatic time adjustment for locations with different time zones, notifications, how patients can view information from home, and how reports can be generated by the user, exported, and used for predictive analysis. Healthy Time was created in 3 months as a prototype for the VA to accommodate high-volume scheduling appointments and requests, and to push and pull information from the 3 VA Vista test site instances that you see here on the upper right-hand portion of the screen. Site and facility names are currently being pulled from Vista. This can be configured to be entered manually or pull from a different EMR source. A site can be used to represent an area, each with a grouping of facilities and clinics or freestanding surgery centers beneath it. Selecting a site shows information only regarding that site. In the current setup, Vista is driving the user access for each site. The selected site does not change when a user navigates away from the home screen. The information for the patient is pulled from the source EMR and shows the patient's name, home and cell phone, date of birth, SSN, gender, insurance information, primary care provider, and any special needs or patient preferences that have been recorded for the patient on file. The patient appointment screen defaults to display all scheduled appointments from this date onward. The status and date can be changed to show all appointments regardless of status based on a from date to present. In addition, appointments which have been checked in, closed, canceled can also be viewed. The from date can also be modified. All appointment history for a patient can be viewed by selecting View Appointment History. Here you can choose a begin and end date to view information and activities for the appointment. This information can also be summarized and shown in reports. Selecting View Appointment Requests displays all existing appointment requests, the date of request, and reason the request was made for the patient selected. Select Add Appointment from one of these requests to create an appointment. If a time slot displays, the time is marked as available and allows the appointment to be booked for the selected resources. Once an appointment is made from the request is automatically removed. The appointments display under the existing appointments are the appointments that this patient has that are pending. The appointment times are the available time slots for the provider based on the date selected. If the patient already has an appointment at the time that is selected, an error message will display, stating that the patient already has an appointment at this date and time. Choose another slot. Notes can also be entered. Confirming and booking secures the appointment for the slot for the patient and the provider. Returning back to the View Patient Appointment screen then displays this appointment at the top of the screen. The provider for each appointment is shown on the patient appointment page. The provider for any appointment can be changed if another provider is available. Select Change Provider to see if another provider is available for the time slot selected. If no provider is available, the appointment can be rescheduled for another time by selecting Reschedule Appointment. Here you can see that Lori Petrie is available for that appointment time. I select Change Provider, and then I get a message that this provider has been replaced for this specific appointment. Appointments can also be canceled from this screen too. Appointments can be scheduled or requested more than a year in advance if the scheduling policy for the resource is set them more than 1 year in advance. If a provider is associated with multiple practices, the appropriate clinic and facility can be chosen and viewed. The schedule for an entire practice as well as a single clinician can be viewed using the provider roster. From the provider roster, I can also select View Patient List with my provider, facility, and clinic selected. This will show me all scheduled appointments that are upcoming for this provider. Appointments can also be viewed using the clinic schedule. Click on Clinic Schedule from Appointments to sort by facility, clinic, or resource such as provider, room, or equipment to view open and booked time slots based on dates. Once a patient shows up for an appointment, it's time to check the patient in. Appointments which have not had a status recorded display. From the patient check-in screen, the patient can be marked as checked in, patient no-show, or the provider can be changed. I select checked in, I confirm, and once checked in, additional options to mark the patient as left without being seen, appointment kept, or change provider display. I select appointment kept and confirm. This information gets recorded into the appointment history, and reports can also be run to summarize the selected information in the appointment check-in screen. Patients who have been placed on a waiting list due to an appointment cancellation or transfer request display on the waiting list page. Here, the amount of days the patient has been waiting for an appointment and the appointment priority are shown. Users can schedule an appointment for the patient directly on the screen. Once an appointment is created, the appointment request is automatically removed from the waiting list. Appointment requests do not need to be manually made. If an appointment is canceled, an appointment request is automatically generated. If an appointment is set for a provider, but the provider later becomes unavailable because a block was made, an appointment request will automatically generate for that patient and cancel the current appointment. If a patient walks in without an appointment and requests to see a clinician, a user can enter the patient as a patient walk-in. This ensures a pre-appointment letter will not be generated for this patient. Letters can be configured for each clinic through the Communication Template section. Currently, a communication queue is set up to trigger pre- and post-appointment, based on appointment cancellation, a transfer, or when a patient is placed on a waiting list because an appointment request was created. Communications can be sent by mail, email, or a text message. Since templates can be configured by each clinic, they can be more personalized to the patient population and can also be triggered to be sent for different types of notifications. Group appointments can be made when multiple patients can be seen at one time utilizing one provider or room. For example, a recovery training class could be held in a larger room which can accommodate 10 patients and have one educator. With the Georgia VA Regional Medical Center Internal Medicine Recovery Educator in the recovery training room. And this is an office visit. It shows me all the patients that are allocated to this facility. I can select some patients and then go ahead and add these patients to the group. From here, I can also click on the appointment time, select all patients, or just select a few now and add more later. Group appointments can also easily be canceled for all patients at once or can be canceled individually. eTime has the ability to schedule and manage telehealth appointments. I select telehealth, search for a patient, select the patient, verify the information is being accurate, and then I'm taken to the telehealth page. Now I can go ahead and add a telehealth appointment. These are appointments for a patient and a resource when each are in a different site and crossing a time zone. For example, a patient located in Alabama and a provider in California. The provider and patient can be booked and the appointment time is adjusted automatically based on the time zone for the provider and the patient. You would create the appointment as normal, search for slots, and indicate the patient's location. Time slots can be configured for each resource. This drives the available resources which display when a user creates an appointment. Time blocks can be placed on any of these resources. Next, we will see how a patient can view their appointments from home. Patients can view their scheduled appointments from home and can install any CalDev client of their choosing. For this example, I am using Thunderbird. Using the patient Hugh Benson, I can view his appointments that I've already scheduled for him. I can view by day, week, multi-week, or even just overall by month, as shown above. I can click on the appointment, and view the information in detail. eTime also contains the ability to run reports. Here's a sampling of reports that were created, allowing users to generate based on the parameters that they choose. Reports can be saved in a multitude of formats, including Excel, PDF, and Word. One example I'll show you today is the capacity, workload, and utilization report. Once my report is run, I can see the report parameters at the top, as well as a detailed list, which shows, in this report, a list of all the patients and their appointments, as well as some identifying information. These arrows allow me to also sort on each of these columns. Below the table of appointments, based on the time parameters that I've chosen and also the site, facility, and clinic, is an average activity type by clinic summary, as well as an activity type count, and that information in a pie chart. There is also provider availability status by hour and caseload utilization based on the provider scheduling policy and how much they're being utilized. Further down in the report, this is actually done for every single resource, including room and equipment. During the prototype period, we created 16 reports which are populated in real time from the application. The reports were developed to aid with scheduling by showing utilization, patient appointment details of missed appointments, DSS stop codes, percentage of completed appointments, and provide up-to-the-minute lists such as patient wait time lists. Additional reports can be quickly created for users based on their additional needs and user roles. Additional enhancements have been made to the user interface portion of the application. We'll be demonstrating that in our next video, which you will see later in the presentation.